Hello everyone. Welcome to Hornbill TV. My name is Paulami. Today we are at Swagat Hospital with Dr. Arindam Barua, a very renowned oncosurgeon from Swagat Hospital, Guwahati, Assam. Sir, a very warm welcome to our show. It is our immense pleasure to have you here today. So today I'm going to ask you a few questions about cancer which our viewers would like to know. So shall we begin?
Definitely, Paulami. Yeah. At the very outset, I would like to thank the people of Nagaland, Hornbill TV, of course, for featuring me in your channel. Thank you. Thanks a lot. I hope that I'll be able to answer all the questions properly and I can be of some help to you.
Definitely, sir. So today at the onset, I'm going to ask you, sir, about breast cancer. What is breast cancer and how common is breast cancer?
This anything now which grows excessively is called cancer. So basically, anything, any tumor, any mass which could not be controlled. So it has to be. We have to be very clear about the definition of cancer. Like cancer is something which has uncontrolled growth. It's not a small benign tumor. You might have a small benign tumor over here also in your hand, but then that small tumor does not go to some huge proportions, and it does not even spread elsewhere. So the term cancer is basically reserved for only those tumors which has an uncontrolled growth. So the definition applies to the breast tissues also. So any such growth which happens inside the breasts, we term it as breast cancer.
Sir, today we would like to know what causes breast cancer.
So basically, there is no definite single answer to this question actually. So there are multitude of factors for this causation of breast cancer. So the number one cause would be, I think, would be hormone related. Now, not only the internal hormones, you see the hormones inside the body actually changes according to the stress, according to the menstrual cycle, according to whether she is pregnant or not, according to lactation and all. So this delicate balance, once there's a disturbance in the balance, it might give rise to breast cancer. Then again, we have familial causes of breast cancer also. It has been seen that if the mother gets the breast cancer, she can actually pass those genes of causing cancers to her daughter also. And there has been some families where this breast cancers run rampant. I would like to give you an example of some Jews, Ashkenazi Jews, who have a very high incidence of familial breast cancers. In fact, amongst them, they have the highest rates of breast cancer, which might be due to the consanguineous marriages in the society. So 1 in 40 women actually of Jews, in case of yes, they have breast cancers. Mm-hmm. So these two are the most common. And then see, with the increasing age, then again we have a lot of factors also, like we are still to adapt to the new life, the modern aspects of life. So basically what happens, previously evolutionary, if you say, the human beings were not designed to sit like this, then not designed to have food like we're having right now. So evolutionary wise, the history of human beings has been quite short. So see, we have fast food now, which we didn't have like 10,000 years back. Even in fact, if you just look back 50, 60 years back, we didn't have that kind of incidence of cancer that we have now. So this is due to mainly due to obesity, due to lack of physical exercise. We have a lot of actually problems with our diet also. We have a lot of refined carbohydrates, which we don't include fruits and vegetables enough. So it might be one of the reasons why these breast cancers are increasing. In fact, all the cancers might have similar etiology. But then if you say a single etiology of breast cancer, we cannot find it, because and most of the time it is actually unknown why the breast cancer has occurred.
So sir, how do we identify breast cancer?
See, a lot of women get lumps on their breasts. So all lumps in the breast are not cancer. identifying the breast cancer by the patient herself is actually quite difficult, and sometimes the lump is a cancer or not, it may not be possible even on clinical examination by a trained doctor, by a surgeon. So in that cases, we have some investigations, like we have mammogram, where we screen the breasts to see if there is any abnormal lump over there. We see the architecture, we see the calcification and all. We have some tools to identify. So next, if the lump which is inside the breast looks suspicious in the mammogram or ultrasound, then we perform a small needle examination. We call it FNSE. So FNSE, yes. FNSE is fine needle aspiration cytology, where we take a small amount of cells from the lump and examine that under the microscope to see what kind of cells are they. Are they cancerous or are they not cancerous? In case they are cancerous, we have more suspicion. We have two options. We may go directly with the excision if the lump is small, or we may do a true cut biopsy. A true cut biopsy is a kind of biopsy. I mean, by biopsy we mean taking out the tissues. So through a needle, we just insert, it's a very small fine needle through which we can take out chunks of tissue from the breast mass. So we can examine that under the microscope, and that gives a very definite answer to the question whether the breast has a cancer or not. So these are to diagnose the cancer, we have these investigations. To know the extent of the cancers, we have the PET-CT and the CT scans and the bone scans. So according to the stage, according to the size of the tumor, according to symptoms that the patients have, we advise the test accordingly.
How common is breast cancer?
See, breast cancer is one of the most commonest, in fact, the commonest cancer amongst women. In fact, 1/4 of all the cancers that women get are breast cancers. Even if you combine all the cancers if you combine the cancers of men and women, if you just have a look at the incidence, the breast cancer comes first. If you even combine the males and females. So cancer of the breast is a quite common condition, and it's very important to identify these breast cancers very early on, because it is not inside. We can actually palpate. We can actually know that there's a lump in the breast, and if the lump can be detected at an early stage, there is a very high chance that the patient will be cured of cancer. In fact, if you can treat the patients at stage 1 and 2, there's a more than 95% chance of cure, in fact, which was previously not possible, but now it has been possible with different modalities of treatment that we have right now.
So now we would like to know what are the treatment modalities for the breast cancer.
So basically, historically, we have always had 3 pillars of treatment of cancer. So one is the surgery, one is chemotherapy, and one is radiation. Now we have a lot of armamentarium. We have more. Like we have now targeted therapy, we have immunotherapy, and now the radiation has advanced so much that we can now pinpoint to the tumor and give a very high dose over there. So see, if we give a dose of radiation, even a smaller dose of radiation to the whole body, the humans will die if we irradiate the whole of the human body. But if we can pinpoint a part of the body and we hit it with a large dose of radiation, there won't be effect to the rest of the to the rest of the body. Only that part will be affected. With advanced techniques, we can actually target a very small area in our body, and then we can kill it. In fact, you must have heard about stereotactic radiosurgery or gamma knife, where actually the surgery is done by a beam of radiation. Now, such kind of radiation is also feasible. And then these surgical techniques have also advanced very much. So we now have the robot. Although we cannot use the robot for breast cancers, but then we can use the robot for other cancers. And with the robot, we can actually see, we have enhanced visualization. We can spare the nerves. Even previously, the concept was that we do radical surgeries. Like with the tumor, whatever, we don't pay heed to the other important structures at all, because the priority is saving the life of the patient. The function comes next. But now with enhanced visualization, we can actually see all the structures. It becomes very easy for us to preserve those structures, taking out the whole of the tumor. So which is possible in the robots only. So now with the advancement of all the three modalities, we now have increased rates of cure. And it's not like that we here in Guwahati don't have access to all these modalities. We have all the modalities over here in Guwahati. Even you don't need to travel to outside states. In fact, previously people went to Mumbai and Chennai for all their once they heard the word cancer, they would just book a ticket and fly off.
True.
But now it's not required. We already have all the armamentarium over here in Guwahati itself.
So now we would like to know about oral cavity cancer. Sir, what is oral cavity cancer and what causes oral cavity cancer?
So oral cavity is we have a lot of subsides inside the oral cavity. See, we have the tongue, we have the lip, we have the buccal mucosa, we have the mandible, the teeth, and we have the palate and all. So oral cavity cancer is a combination of cancers at 6 different sites. So if we get the cancer in any of these 6 subsides, we call it as an oral cavity cancer. And you also asked me about the cause of the oral cavity cancer. See, for breast cancer, I didn't have a single answer to this question. There's no one answer. So for oral cavity cancers, we can actually answer that it's actually due to tobacco. And hereditary, it's very less. There's only reports of tongue cancer being hereditary, but then we don't get it over here. Most of the oral cavity cancers are actually due to chewing tobacco, taking gutka and all.
So how can you identify the oral cavity cancer?
See, the identification of these kind of cancers are very easy actually. You just need to have a mirror and one torch. So just open your mouth and see if there is any ulcer over there or anything which looks to be suspicious. Like there might be any change in the mucosa also. From the usual pink, if it goes to red or if it goes to white, then it becomes suspicious. That patch might go and that might proceed to cancer later on. But then see, the challenge is that not everyone can actually diagnose these ulcers as cancers. See, one thing is you have to remember one thing, that any ulcer which does not heal by 3 weeks might be cancerous. See, people who have gutka, chew tobacco, they almost invariably they must have had some kind of ulcers in their lifetime which actually gets healed over time. But then people only come to us when they think that okay, this might heal conservatively. So they just wait for the ulcer to heal. But then by the time they become concerned regarding this non-healing ulcer, it becomes quite late sometimes. So as soon as you get an ulcer which is more than 3 weeks, you should actually go and consult a doctor, because that might be cancer, and the biopsy has to be done to diagnose that condition.
So we should be very much careful if we get a small mouth ulcer also, right?
Right. See, anything which does not heal, anything which is quite abnormal, you should go and see a doctor, not necessarily an oncologist. But then if the doctor also gets concerned that it might be a cancer, he will refer to an oncologist.
So we would like to also know the treatment modalities of oral cavity cancer.
So like every cancer, we have 3 modalities. See, for this also, in the early stages, we go for surgery directly. So surgery is the only modality where the cure can be achieved in stage 1 and 2. So all other modalities are actually adjunct or ancillary. And radiation can be given in early stages also, but then surgery is preferable, because radiation has its own set of side effects, like the patient will lose all the sense of taste. So that's something which we like to avoid. So the lifelong he won't be able to feel any kind of taste. which is actually distressing for the patient. So most of the time we go for surgery, and if the tumor is quite big, then we go for a surgery plus reconstruction. So this reconstruction is a different thing now. So for most of the cases, if the tumor is quite big, we don't have much soft tissue cover. Like see, this facial area is cosmetically very, very sensitive. So if we just keep it open, it won't do, because you have to cover the skin with something. And then how do we get the skin from? Most of the time we get it from the chest. And now actually we have some techniques of reconstruction of the bone also. We take a graft from the leg. It's called a fibular graft. Along with it, we get a free flap from the thighs. So this is a new thing which has come up, and this gives us the most cosmesis, best cosmesis as possible. This free fibular graft along with the free flap. So it's very important for the patients to know that if the tumor is treated at an early stage, you don't have to go for such kind of mutilating surgery. So see, bigger surgeries in other parts of the body is okay, because cosmetically they won't be affecting the patient. But then face is something which is actually quite sensitive part of our body. We all want to look good, right? So it's very important for us to not to have tobacco. If you have tobacco, you'll have to get rid of it as early as possible. And even if you have such kind of suspicious lesion, you'll have to. It's very important that you see a doctor as fast as possible, because it will grow very fast, and before you know it, it will spread. It's better if you treat it. At the earliest. Yes.
So now we would like to know about esophagus cancer. Sir, tell me something about esophagus cancer.
Esophagus is that part of the body which takes all the food from the mouth to your belly. So we commonly call it as food pipe. So any cancer that happens in between, in that anatomical structure, we call it as esophageal cancer. And see, the etiology, that means the causes for esophageal cancer is commonly smoked food and tobacco. It's the same as for oral cancers. The oral cancers are mostly due to the consumption of tobacco, but then in esophageal cancer, along with the tobacco, you have smoked food also, which is actually very common. Taking of smoked food is very common in Nagaland. If you compare to the people from Assam, like in most of the northeastern states, actually they have the habit of smoked food, and this might be a reason for cancer of the esophagus and in fact stomach also. So we have got two types of cancers in esophagus. One is the squamous cell carcinoma and one is adenocarcinoma. So the etiologies that I have just told you are for squamous cell carcinoma. You must have noticed that some people, after they have the food, they have heartburn. They complain of burning sensation in the chest. They complain that they don't feel easy after having a meal. Then they have some symptoms of gastritis also. So those patients commonly have reflux of the gastric content to the esophagus, and those kind of patients actually get adenocarcinoma later on. So as the time goes, so basically these are the etiologies, the most common etiologies of esophageal cancer. You have more etiologies, but then it might not be relevant. And again, you have to notice that, note that having very hot tea or coffee can also get esophageal cancer. Yes, the cancer of the upper esophagus is possible and has been shown, it has been shown that taking very hot beverages can actually get you esophageal cancers.
So how will the patients come to know, like what are the symptoms of esophagus cancer?
So the most common symptom is progressively the patient won't be able to swallow. So the complaint will be like, previously the patient had difficulty in swallowing of the hard food, and then gradually as time progresses, he will have difficulty in having semi-solids also. He will have difficulty in taking liquid also. And at last, which we call as a grade 4 dysphagia, at last the patient won't even be able to swallow his or her saliva. I mean, see, the problem with esophageal cancer is that the most of the patient actually come to you when the patient can actually no longer have liquid diet, or they can no longer actually even swallow their own saliva. So esophageal cancer is a very dangerous kind of cancer because the patient's nutrition is quite down. We cannot give the patient a very aggressive treatment sometimes because the nutrition is already depleted. See that all the three modalities of cancer treatment is very toxic for the patient. I mean, even if you see the surgery for all types of cancers are actually quite big, and the surgery for esophageal cancer is actually one of the one of the most major surgeries that we do. So for the patient to be fit for the surgery, actually we need the patient to be fit nutritionally so that the patient can take that kind of surgery. So very often we see that the patient is nutritionally depleted, and we are not able to give the patient a curative therapy because of nutrition. So it's very important that the patient, as soon as he or she has some problems with swallowing, they come to at least a gastroenterologist or an oncologist to get an endoscopy done. Okay. On endoscopy, once we see any suspicious lesion, we take a biopsy, and from that biopsy we can actually diagnose that tumor to be cancer if the tumor is cancerous.
So what do you think? What treatment is there for the esophagus cancer?
Okay, so we have surgery. Like I just told you, like the surgery that is being done for esophageal cancer is quite big surgery. And then again, we have radiation also as one of the most common modalities of treatment over here, and chemotherapy. See, here we need trimodality therapy. Like in oral cavity cancers and breast cancers, the surgery always takes the upper hand. But in esophageal cancer, because the patients are mostly not nutritionally well off, we have to subject some of the patients for radiation therapy also. In fact, most of the patients that we see in our practice will need radiation and chemotherapy first, and after that only, if the patient improves, actually it's a part of the trimodal therapy also, we see better outcomes if we give the radiation and chemotherapy first, followed by the surgery. Sometimes we may even give chemotherapy prior to surgery also, but then all these three modalities are needed for proper treatment of cancer. So all the three modalities, chemotherapy, surgery and radiation, everything is required in this cancer.
So now I'm going to ask sir about stomach cancer. Like, what are the symptoms of stomach cancer and what causes stomach cancer?
See, these luminal structures, the GI tract actually starts from our mouth and ends at the rectum. So basically, anywhere, if we get an obstruction due to some growth or cancer, there will be some symptoms. Like if you get a growth inside the esophagus, the patient won't be able to swallow. If the same growth occurs inside the stomach, the person will be able to swallow, but then the patient will vomit it out because the food that you have just eaten won't be propulsed. It won't go further than the tumor. See, at one point of time, the food will just stop and it won't go any further. See, the musculature of the stomach will try to propel the food, but then it won't go because there's a mechanical obstruction. So basically, the patient will come to you with the problem of vomiting. And the patient will say that whatever he eats after half an hour to 2 hours, everything that he or she eats comes out through vomiting. The patient will also have a sense of fullness after having a small amount of food. Even the patient will lose weight, and the patient may also come with heavy bleeding from his mouth, or he might have melena, that means black stools. So these are the most common symptoms of stomach cancer. And see, this it's not like these cancers are not present from before. This is the extreme, the symptoms that I have just told you is the extreme end of the symptomology. So prior to that, the patient will have some sort of gastritis. The patient will definitely have some sort of discomfort. So what happens is that, what we commonly see is that the patient has gastritis, he goes to the pharmacist, he takes some medications over the counter. If you just delve deep into the history, they will say that I have been taking this kind of medication since the last 1.5 to 2 years. So these patients actually have problem from quite long. But then they self-medicate, they just focus on the symptoms. Once the symptoms subside with the medication, they don't even take any medical advice. And once these medications stop working and this kind of symptoms happen, only then they come to us. So it actually becomes quite late by then. So through this channel, I'd like to suggest that in case of, don't neglect any such symptoms of gastritis even, because the symptoms of gastritis might be cancer also. You can never say. But most of the time, if the gastritis, if the problem, any pain abdomen does not respond to any kind of medication, most probably the patient has the cancer. Some kind of serious problems going on inside.
So due to our negligency, this might go to a very big thing.
Yes.
Yeah.
In fact, all the cancers can be diagnosed quite early. Not all actually. Most of the cancers can be diagnosed quite early if there's no negligence on the part of the patients.
Sir, we would like to know one thing. Since Swagat Hospital is known for robotic surgery, so what all cancers can be cured through robotic surgery? Our viewers would like to know.
Yes. Actually, see, apart from the breast and the head and neck cancers that we have just mentioned, we're actually doing a lot of GI cancers and esophageal cancers also over here. So it's not like that this oral cavity cancers, head and neck cancers, and breast cancers cannot be addressed through robot. But then there's not much need of the robot actually in these cancers, because these are all surface malignancies. We can very well access these tumors. But then the most commonly we use the robot for esophagus, then stomach, then colorectal cancers. So we're actually using mostly for these three conditions, and we're trying to expand these indications more, and maybe in the future would like to delve into, go into breast cancer and then oral cavity cancers, head and neck cancers. But right now we're limiting ourselves to thoracic and abdominal cavity cancers only.
Thank you so much for today's show, sir. It was really informative and insightful. And we are really lucky to have you here, to have connected with you. Thank you.
The pleasure is all mine. Thank you. Thanks to you.